compress him down and he says that makes it worse, you know it's from the neck. So that's the Spurlings compression. So you just literally just push his head down. Yeah? If he's got the arm pain, you might find if I stretch his head, he might say to me it feels better. So that'll be the distraction. Compression, distraction. Easy enough? Yeah, so you literally compress or you stretch. The Valsalva, he's got arm pain. Anything where you increase pressure. For instance, like a Valsalva will be when you go to number 2 in the toilet and you go to push and you're like, oh my god, it's so sore on my back and my leg. Yeah? But if you mimic the movement with your thumb, so you can have a suck the thumb or blow out your thumb, just try that. Yeah? Okay, or blow out your thumb. So you increase pressure. That could make the arm pain worse. That could make the leg pain worse because you increase pressure. And the idea of pressure, if you say to your patient, go to cough without coughing, go to sneeze without sneezing, so that sort of movement of pressure, or go to the toilet without going, of course, yeah. And then you think, yeah, what does it feel like? If you say to them, does it hurt when you go to the toilet? And like, oh God, I'm so sore, my back and leg pain when I'm going, especially when I'm constipated, etc. And you might find, you know, when you're trying to push, it's really sore. And that would be like a Valsalva type of maneuver, just a pressure test. Yeah. And the idea behind the test is, if you have what we call a space-occupying lesion, then any pressure built up around it causes pain. So a disc occupies a space, yeah, in a natural way. The disc is already there, but then if it's prolapsed, then it goes into the space. By increasing pressure, pressurizes that space, and then you get the pain. So that's a Valsalva. Anything where you cough, sneeze, bear down, blow your thumb, suck your thumb. Happy with that? Swallowing test. I remember I was manipulated many years ago by a friend of mine, a good friend of mine, and weirdly, for about 2, 3, 4 days, I found it difficult to swallow. So I'm not sure whether he had adjusted my neck a bit too overzealous and caused a reaction and a swelling of this, but literally when it felt like something was stuck. It didn't feel very good, but it did settle down. So if you've got some protrusion from the disc, it could obviously affect the trachea or the esophagus when you swallow it. So just more so obviously the esophagus when you're eating food and things. If you feel there's a blockage, then maybe obviously you've got to be thinking nasty things as well. But in relation to neural, that sort of thing, then if you've got some symptoms and the disc is a bit swollen, then it might restrict the movement. Okay, that's easy enough, isn't it? Yeah. So you just ask your patient, do you have any discomfort in swallowing? Not that you ask all these tests. The Adsons test. This is for a thoracic outlet, TOS, thoracic outlet syndrome. So for instance, he complains of some sort of symptoms in his arm. Rather than like defined to one area, it's like a vague sort of symptom. He feels it's in the whole of the arm. So maybe like a TOS, thoracic outlet. Palpate with radial pulse. And then lightly palpate, you can feel my fingers there. Yeah, so no problem. But don't squeeze it too much because you will restrict it. Lightly bring them up to 90 degrees, 30 degrees of a horizontal. And then maintain the pulses and you still feel okay. Take a breath. Hold your breath and just turn towards me. Hold it, hold your breath. Okay, relax. Take a breath in. Hold your breath. Turn left. And relax. Okay, pulse stays the same. Alright, if the pulse changed, then obviously you are restricting the artery from here. And then if it seems to just, instead of doing that, it might actually be quicker, yeah, because blood's trying to rush there. Yeah, that sort of thing. Or a person says, oh my god, my arm is numb. Yeah, then you know what you're concerned. So it tells you that more likely scalenes or first rib. So thoracic outlet from scalenes, because you're lifting up first rib, and you rotate to compress, and you rotate to stretch. So I'll give the Adsons test.